The organization of dental department. First and foremost, let's discuss the history. In the past, dentistry was considered a division of the Department of Surgery. And because of this, hospital dentistry experienced limitation in exposure, staffing, privileges, care of patients, and care associated with the performance of routine and major extraoral. Currently, this concept has been changed. The dental department is now organized as a separate and independent department. This gives the opportunity and responsibility to exercise judgment in staffing, generating protocols for operations, and establish training programs. Within the departmental organization, there are four major service units: the admitting service, outpatient service, casualty or emergency service, and the consultation service. Now, let's talk about the admitting service. This type of service allows the general dentist or the specialist in the faculty to admit patients and care for them in the operation room of the institution. Dentists who use the hospital for inpatient and ambulatory surgical care are usually general dentists treating handicapped and mentally challenged patients, oral and maxillofacial surgeons who require operating theater because of the nature of surgery. The admitting service is responsible for the care of the inpatients as well as their discharge and follow-up. In most hospitals, this department performs the outpatient treatment, follow-up of discharged patients. Also, in smaller hospitals, this service performs the consultation. The team consists of general dentists, oral and maxillofacial surgeons, pedodontist, orthodontist, periodontist, prosthodontist, endodontist, and conservative dentist. While the first three are essential as full-time faculty, the other specialists may be considered either for full-time or part-time consultants, depending on the nature of work and the needs of the community. The third major service unit is the casualty service, or otherwise known as the emergency service. This department organization is prepared to care for patients requiring immediate and emergency care. Patients seldom seek emergency care for routine dental complaints such as dental pain and mild infections. Patients who need dental procedures require the services of an oral and maxillofacial surgeon for the management of the facial-maxillary injuries or severe dental infections. Very often, the oral and maxillofacial surgeon is called for the emergency management of polytrauma cases along with other medical specialists. These opportunities should be considered as one of the best opportunities to serve the community as well as to demonstrate the mettle of the dental profession. The last departmental organization unit is the consultation service. The necessity for dental consultation in hospitals was first accepted when it was noted that patients with major diseases also had orofacial and intraoral complaints. Such diseases often have the potential to influence the outcomes and required surgical and medical therapy. Bleeding gums, loose and carious teeth, unexplained facial pain, ulcerations of oral cavity, oral manifestations of systemic diseases, intraoral infections, limitations of mouth opening, and oral metastatic disease contribute to the need for dental consultation. Currently, the dental department responds to consultation requests from the following departments. The general medicine. The dental department helps to identify the focus of infection and oral manifestation of systemic diseases. Next is the dermatology. Patients are often referred to the dental department to rule out the oral focus of infection, oral manifestation of dermatological diseases, and for biopsy oral lesions. The ear, nose, and throat department. to rule out oral focus in the management of unexplained facial pain or in the management of sinusitis. Very often, dental consultation is sought. Similarly, for the fabrication of surgical obturators and final obturators following maxillectomy, the services of the dental department is essential. The plastic surgery. The dental department helps to care for patients requiring the construction of obturators and similar maxillofacial prostheses. They work closely with plastic surgeons for the management and rehabilitation of cleft palate patients. The intensive care unit. Patients in intensive care unit who require diagnosis and treatment of orofacial and dental diseases that is associated or exacerbate acute diseases need dental consultation. The cardiology. The dental department provides service for patients undergoing major cardiac surgery who require pre-surgical dental extraction, oral prophylaxis, and restorative and periodontal therapy. Patients with history of ischemic heart diseases, those with pacemaker or valve replacements after bypass surgery, and with rheumatic heart disease or congenital heart diseases are referred for dental department for treatment which requires special attention. The oncology department. Dental consultation and treatment form an integral part of the preparation of patients scheduled for chemotherapy and radiotherapy. These patients require removal of focal infection, restoration of carious lesions, and maintenance before, during, and after therapy. The Sleep Apnea Syndrome Laboratory. The dental department aids in the preparation and construction of anti-snoring, and it helps in the preparation of patients for surgical correction of skeletal deformities influencing the condition. Thus, by providing necessary services to the above category of patients, the dental department forms an integral member of the multidisciplinary healthcare team. The staff of the dental department should always be on the lookout for the opportunity for providing additional services to the patients by taking active part in clinical discussions and case presentations. Recent advices in dentistry, which has implications in the dental management of hospital patients, should be conveyed to the medical staff whenever an opportunity arises. Referrals from general dental practitioners. A positive relationship between the dental department and general dental practitioners is vital to both areas of practice. Very often, the general dental practitioners hesitate to manage patients with moderate and severe systemic disease in dental office because of the possibility of development of emergency situation while treating such patients. Dentistry benefits those patients who need specialized dental care. Thank you for listening.